to Brittany about how many people accepted the invitation.
Hi, Tanisha. Sorry about that. I was muted, but it looks like we have a majority of people joined so far, so I can go ahead and get started. Hi, everyone. This is Brittany Mitchell from the Institute for Community Inclusion, and welcome to today's Community of Practice discussion on measuring impact. Before we get started, I can walk you through a few tips for how to best use the Zoom platform that we're using to connect today. We like to make this discussion as interactive and engaging as possible. So throughout the presentation, if you have any questions or comments, please feel free to type them into the chat box. In addition, if you'd like to actually chime in via your audio, please feel free to mute or unmute yourselves using the microphone icon on your computer screens. If you have a red slash over your microphone, it means that you're currently muted. And if you click the microphone and the red slash disappears, that means that we can hear you. We should be able to hear you. So just as a brief reminder, if you are not speaking, please remember to keep yourselves muted so that we can prevent any background noise. This session is also being live closed captioned and recorded. And the link to the recording will be shared with everyone at a later date. Last but not least, if you have any questions or encounter any technical issues, please feel free to address them to me, Brittany Mitchell, in the chat box, and I will get back to you as soon as possible. Also, as a reminder, there is a phone number to call in case you encounter any issues with the audio via your computers. Thank you, and without further ado, I'd like to hand it over to Tanisha from BCG.
Good afternoon, everyone, and thank you for joining us for this community of practice discussion today. As I think most of you already know, this conversation is the continuation of a three-part training series that BCT has been doing with the Department of Treasury CDFI fund. And we've also engaged a number of subject matter experts who are going to actually do the presenting or actually lead the conversation, I should say, today, including Jack Brummel, Charles Hammerman, Danny Housley, Carla Mannings, Toby, Parch Davies, Michael Swack, and Susan Tackhall. I always mess up Susan's name, but without further ado, I believe that Jack is going to be our lead today. And again, we appreciate your time and your participation in this wonderful training series, and hopefully you get a lot out of today's discussion.
Hi, everybody. This is Jack, and thanks so much for joining us. We really appreciate your commitment to this work. I just want to preface the conversation today by letting you know that we really want this conversation to be fluid and flexible. We encourage you to engage in the conversation. We're eager to hear from people about your experiences in measuring impact and any questions you have of the presenters and any concerns you might have on this subject area. So to kick it off, we're going to start with Michael Swack. Michael, you want to go ahead? Let's look at the agenda.
Sure. Yeah, we can switch to the agenda, but essentially want to start with why is data even important? And I mention this because I've worked on measuring impact and on CDFIs in particular over many years. And one of the things I've learned is that CDIs often don't measure impact. They just assume it happens. And oftentimes, but one of the things we want to talk about today really is the idea of how you can measure outcome, how you can measure impact in ways that are simple, easy, and fairly inexpensive. Because one of the reasons CDFIs often give for not collecting data on the outcomes of their loans is because it's too expensive, too time consuming, and by the way, their job is to make more loans. But data is important because it tells us something about what's happening to the people we lend to. So when we look at outcomes versus outputs, An output is what we usually collect well. An output is how many of something. How many loans did we make? What was the delinquency rate? What was the default rate? What's the volume of lending that we've done? We're really good at collecting those data, and that's what the CDFI fund often asks for. An outcome, though, is something that tells you how are people better off. When you make that loan, how do you know it's not just repaid, but the person's actually better off? So that's the difference. We want to talk today about what are some measures, what are some methods of measurement that are, like I said, simple, easy, and relatively inexpensive that will tell you something important about the outcomes, how the lives of the people and organizations you're lending to are better off. So I think, Jack, we can see if there are questions or people have comments and perhaps move on. I know.
Yeah, so on outcomes and outputs, Michael, we've got you going first, followed by Susan and Carla. And I think that Toby might have something to add as well.
Right. Well, I started with the definition. So Susan, I think you were going to go next.
Okay, thank you. Can you hear me okay?
Yep.
Great. So one of the things we try to measure and evaluate is our Pennsylvania Assistive Technology Foundation's, our mini loan, credit building loan, which goes from $100 to $2,000 at 0% interest and 0 fees. So we're trying to look and see, does this product, which is fairly labor intensive and certainly doesn't pay for itself, is it a useful product? So a couple of years ago, maybe 2 years ago, when in Pennsylvania, the federal legislation of the Workforce Innovation and Opportunity Act went into full force, helping transition age youth with disabilities, you know, get prepared for life after high school and get employed, we decided to do a significant outreach effort into this community and teach them about financial education and about our mini loan program and to see if that made a difference. So we counted every event and every training session that we did and how many youth participated. So that, for example, in the first 6 months, I can tell you we talked to about 300 youth who were close to graduation, so 16 to 21. And then what we measured was how many people came to our website to download our financial education book, Sense and Sensibility, and then how many people came and got a loan. So those three bits of information, those were outputs. How many people did we talk to? How many people downloaded Sense and Sensibility of that group? And how many people came and took out a loan? So our short-term goal was we were trying to help people 18 and older, in this case, take out a mini loan so that they would have access to credit for the first time and be able to get the assistive technology that they wanted. And we kept track, again, of, in terms of outputs, what were people purchasing. Most of the students were purchasing iPads or smartphones. So then what we did was that loan product goes out a maximum of 3 years. So many of those students, they've finished up their second year and they have paid off their loan. So we did a survey as people paid off their loan to find out what were the results. And that came into our long-term goal, because the long-term goal that we have is that people are able to do the things they want to do. They're able to get a job and live in an apartment, for example. And what we found was that several people were able to communicate more with their family and friends, look for a job, and get their job. So we combined in this package both the outputs, the numbers of people we approached, the numbers of applications that were closed, the numbers of our financial education book that were downloaded or we mailed out. And then in our longer term, which right now it's really only 2.5 years, of what happened as a result of that AT. So I think for me that kind of symbolizes that difference. Oftentimes we don't get to report on our outcomes, that some of our funders are really only asking for outputs.
Okay. Thanks, Susan. Carla, you had something to add.
Okay.
Jack, are you calling?
Hello, can you all
Who did you
hear me?
call in? Yeah, okay.
It was
Okay.
Carla, and then Toby, I'll ask you to follow.
Okay,
Correct.
thank you.
All right.
Sorry, I had a hard time unmuting myself. So we at Partners for the Common Good, we have recently really explored the idea of outcomes. As Michael said earlier, a lot of CDFIs, you have some CDFIs that, will do some, data collection. But when it comes to CDFIs really doing a great job in measuring outcomes, I know I find that you have less of them. And the way we approached it, or why we approached it, is because we received a grant from the Kellogg Foundation. And as a part of the program, they asked us that we had to do an evaluation. And so what that meant is that we actually hired an external evaluator, and then I serve as the internal evaluator inside. And so as CDFIs, as we work with others, we need with other funders, such as foundations, it's really important that we understand methodology. And so the way we have approached it in terms of the outcomes is we look at them in 3 ways. So you have, what are our activities? What are we trying to achieve? And then how successful we are the outcomes. And then they can be broken out into 3 different segments. Immediate, which is what can be achieved within a year. Intermediate, 1 to 5 years, and then long-term can be 5 years or greater. And then another way to look at it is in terms of answering the questions, what, so what, now what? What that means is what data are you collecting? So what is, okay, you collected the data, what does it mean? Now what are those outcomes? And there are different methodologies of evaluation that you can select from. And the ones that I know I personally like to look at is in terms of the ones that, as you're learning and you are working your programs, can it be changed? And so as we continue to advance in what we do, the ability to say, okay, we did that, it worked, or we found out something new, so let's change what some of those outcomes, what we are looking for to achieve. And in that way, the information doesn't get stale, or the learnings don't get stale.
Okay. Thanks, Carla. I'm going to ask Toby if she has anything to add before we move on to
Sure, and I'm limited because I don't unfortunately have the access to the actual what's on the screen right now. But if you could advance to the matrix that has the logic model on it, I'll just highlight this example. And Susan largely, spoke to many of these. Much of this content that is here, but I would just, encourage you to look at this as an example, and just knowing that so many of you on the call and in the audience on the Community of Practice call participated in Access for All training. Some of the inputs here, these are all of in the first column inputs, are things that you do to prepare for implementing your activities. So the Access for All training, your CDFI personnel, making sure they're ready, they know the audience they're trying to reach. We talked a lot about, at least in serving the people with disabilities, access to a benefits counselor for a consumer lending activity anyway, and then making sure that your website and your location is accessible to people with disabilities. I'm not going to go over the activities of this particular example, which relates to serving young adults with disabilities, because Susan already talked about it. But just highlight what Carla said around short-term, mid-term, and long-term outcomes. It's really for you to decide what would be considered short-term, mid-term, or long-term. I just want to highlight that short-term tends to be a focus on a change in knowledge and skills if you're looking at helping families or individuals, whereas midterm or intermediate outcomes have to do with actual behavior change. So whether that's paying their loan on time or saving, whatever those desired midterm outcomes are, those are examples of behavior changes, whereas the long-term outcomes are really the change in condition that Susan talked about. How did it really transform someone's life? Is it because they were able to be successful in a career path, attend college, or becoming more independent, improving their quality of life? Those are more long-term outcomes. So it really depends on the project, and it depends on what you're actually implementing for you to decide what is appropriate.
Thanks. And I couldn't tell if you were addressing determining appropriate outcome measures or addressing the first outcomes and outputs.
Yeah, I can highlight, and I can highlight, that, and also Danny, I'm sure would have some comments around that. But whenever possible, you want to make sure that you're implementing with a good practice, or what's the best practice. So in this training, Access for All, we've talked a lot about this being a value-laden kind of market where people with disabilities are really focused on self-determination and choice and having control over their lives. And so from the standpoint of how your lending activity operates, how your services are availed, really putting people with disabilities first. And I don't know, Danny, if you have comments around that or not, but that's what that's meant. What is meant by that is that it's a good practice. It's a cutting edge practice.
Okay, good, thanks. I want to turn to the participants now on this issue of outcomes versus outputs. Can you let me know if any of you have experiences here that you'd like to share, or concerns or questions? Okay, I'm not hearing anything from the audience. Let's talk about determining appropriate outcome measures. Did you have anything else to add on that? Charlie, what you listed for determining appropriate outcome measures.
Okay, hi everyone. Hopefully everyone is good and safe. So we were very fortunate because in the last couple of years, we were introduced to the concept of getting rated by AERIS, A-E-R-I-S. And in doing so, we made a decision to go through that process. It was a board decision. And as we went through signing up and learning what all that meant, it was a big focus on rating us in terms of how we were doing collecting social impact data. What was wonderful was that while we were trying to sort of measure certain things ourselves, they presented us with an effort that was done by, I'm giving a lot of acronyms here, by the GIN, G-I-I-N, the Global Impact Investing Network. the GIN had spent a lot of time with Eris and others trying to come up with some standardized categories of measurement. This is one of the big things that Michael Swack, who's on the phone, has been talking about for years and years, is how do you standardize as best you can? And in this case, we were presented with a laundry list of different categories that they had determined would be some format of standardization. And then we were asked to select among that laundry list as to those categories that were appropriate for us. So for instance, if there was anything in the healthy foods initiative categories, we did not select those because we do not do that kind of work. But what we were able to do was select things that were appropriate for our organization. What was really wonderful about that exercise was for us to then go back and actually teach Eris how they were not including some categories and they needed to adjust some language with regard to people with disabilities. So it was a two-way street where we received these standardized categories, and that was very helpful for us. And in the same token, here you had a big organization that's trying to teach CDFIs how to standardize. And for our niche and for the discussion on this call, as well as the group that we're working towards here, disabilities really wasn't represented in the correct way. So we corrected all of that, and that was 3 years ago. So now what we have is the same categories that we utilize over and over again, and we get reviewed by Eris so that if anything were to change on their side, we would get notified. And if we find that there were better measurements for us, we would let them know. In addition to the categories they came up with, we had to, and they allow you to suggest other categories that are appropriate for your particular CDFI. We actually suggested some other additional categories talking about leveraging, meaning if we put $1 into a loan, how did we then lever that money with a financial institution, another CDFI, a government service, or even individuals. So for instance, if we did a participation with another CDFI on one loan, not only would we tackle how much money we deployed or how many units we created or whatever the category was, we actually also kept track of, and to this day still keep track of, how much money did we attract with our lending from another CDFI. So if we did a $200,000 loan, we did 100, another CDFI did 100, then we would place that extra 100 into that category. It was just a nice way of telling our story. And then we also created another category of takeout, meaning that we wanted to show that when we were going to do the difficult lending in the world of disabilities, in the early days, the criticism was that financial institutions and others may not really be interested in disability work. And the way that we tracked that was takeout. So when we did a loan and the loan lasted for 2 years, 3 years, or 4 years, whatever the term was, and then the takeout was from a mainstream financial institution, again, it was a wonderful thing to be able to tell our story, to be able to say, look, here in the world of disabilities, financial institutions actually do care. We just needed to sort of massage the loan over a few years to get it ready. So think about it from your perspective of your own CDFI. There are no right or wrong rules here. It's just a nice measurement tool to be able to utilize for yourselves. One last note on all of this. Everyone on this call, I assume, has some form of loan software. And what we did 3 years ago when Eris gave us the GIN categories, we actually went to our loan software company and we said, could you add this into the software so that when we are tracking a loan for amortization, delinquencies, anything else that is appropriate just as a loan, we could put more data in there in a standardized way for capturing that data at the end of the year and such. And they did that for us, and they actually did it on without charging us to do it because they were fascinated by the concept. So again, another thing is not just which categories and how are you going to figure out what categories are good for you, but don't forget about the fact that try to make it easy for yourself to track the data, measure the data, and then, collect the data and then measure and tell your story. The data for us has been a very big storyteller in the world of disabilities. So let me stop there and hand it off to the next team member.
Okay, thanks, Charlie. Susan, you had some comments on this topic. So is Susan still with us?
Oh, yes, now I am. So we collect a couple of different kind of data points, and I think it blends in nicely with what Charlie was trying to say, which is telling your story. So the first point is I like to think that our organization is very responsive to people and that we're accessible to people and we act in a sense of urgency. So that the end of every loan decision and then 3 months out and 6 months out, we send out a satisfaction survey to make sure that we are acting in the way I'm hoping we're acting, and that in the 3 month and 6 months is, is this device working for you? Because we are consumer lenders of assistive technology devices. And that lends to the second data point that is important for us, and that is measuring delinquencies and default rates. And we believe we take incredible risks on some people, like we give loans to people who have 0 credit and people who have, 500 credit, but really our lowest is around 600, and then looking at that debt to income up to 50%. And the way we get there is we're looking at delinquency and default rates. And so for a number of years looking at that, we've determined that 0 credit scores are not risky at all. In fact, we get paid back every time really on the 0 credit scores. But except for farmers, we have found that really if you're lending out to someone who has a debt to income of greater than 60%, that's a really heavy duty risk. So then we're looking at how much someone's trying to borrow. But those are some of the data that we're collecting that helps guide the kind of program we're developing.
Okay, thanks, Susan. Toby, before we turn it over to the participants for any questions or comments, Toby, I just want to make sure that you addressed every point you wanted to on this determining appropriate outcome measures.
Yeah, I mean, it really is based on what you as a CDFI wants to measure, and measuring impact. It's important for a lot of reasons, as the other team members mentioned, for fundraising, for performance measurement, program effectiveness, program impact, and quality improvement. Those are all good reasons why to collect data. I think when we get to a future slide, I can sort of walk through an example of some of the methods that can be used.
Okay, thanks, Toby. So I'm eager to hear from TA participants. Let us know what questions you have or experiences you have here on determining the appropriate outcome measures.
Hi, this is Lorraine. I was wondering, you mentioned tracking default rates. How about tracking non-default rates? Like, so those clients, like what's working, what things are helping them from not defaulting, I guess. That's what I'm trying to say.
Susan?
Can you hear me?
Yes.
Okay, I think that's a really good question. Because we are mostly focused on when we're closing a loan, we've talked to these people so many times in our program, an average of 12 times to 14. And so we have turned it around from your point of view, which I think is a really good one. We're looking to see at our risk. We are assuming that people are we're hoping and crossing our fingers everybody's going to be able to repay their loan. But what we're doing is trying to increase our risk. And so that's really what we've been focused on.
Okay. So it's a good thing to track that.
Right, but it's also, I think, because we have a couple of bankers on our board of directors, they have for a very long time been critical of how many touch points we have. But we've turned it around by saying, but look at our default rate, and these are people that you've already turned down.
Okay, sounds good. Thank you.
That's a good question.
Thanks, Lorraine.
Yeah.
Anybody else? Comment or question before we move on? Okay, the next topic is the use of proxy measures in measuring outcomes. And Michael, we're going to hear from you first on this.
Sure. The idea of proxy measures is that maybe somebody has already measured something that you don't have to, or something that you've done already tells you something about the outcome so that you don't have to measure it. And sort of the classic example of this that's come up in community development related activity was really put forth by a guy named Jim Heckman, who's an economist at the University of Chicago, who did one of the most intensive studies of early childhood. A lot of what's talked about in terms of when we ask the question of what works today, what sort of social programs, community development programs work. What you often hear is intervention, early childhood education is one of the most important things you can do. And a lot of that comes out of Jim Heckman's work, where he came across a large database, without getting into the details too much, of a large number of young children who had an intervention, and it really was almost random. So you always say that the best information is if you can actually prove an intervention works in a randomized control trial. He had something similar to that in Michigan, where certain children were randomly selected, and then he was able to do something which none of us can ever do, which is to measure outcomes many years later. And what he found was that compared to any other intervention that had been measured, that if you can provide early childhood education, you will get better outcomes in 20 years than practically anything else you can do. And so a lot of people talk about that now. One of the reasons that people say early childhood education is so important is because there's so much demonstrated proof that it leads to better outcomes when compared to those who don't get it. So a proxy measure would mean if you are providing loans, for example, to provide early childhood education, you don't need to follow the child for 20 years to measure the outcome. You can use the proxy measure, which is the study that's done, the multiple that have been done that show the impact of that. So you can also do that to some degree in other types of lending. So when we look at lending for people with disabilities, we know that if we provide employment, that employment leads to more income and a better outcome. That is, making more money or making money when you didn't before is a good outcome because we know that it will lead to better things happening to you, higher quality of life, more enjoyment of life, better feeling about yourself, all of those sorts of things. So one of the questions we ask is, are there ways in which you can use proxy measures as a way of generating outcome measures without having to do the measure yourself? And Charlie, you have a good example of one which you should share with the group.
Thanks, Michael. I'm actually going to throw in an extra one, two of them,
right.
and they're both on the employment side. So to Michael's point about proxies, when we're looking at specific loans, in the disability world, if there is for instance, a housing situation and they're going to have attendant units or services, the developer may not be in the realm of doing disability work all the time. So therefore they would be a poor proxy. You would have to sort of stay on top of them and try to find out, well, did you get the results that we would like to see off of the loan we did? In employment, we have two very specific examples for you where the borrowers came to us specifically for not just the operations of their companies, but because the operations of their companies were, then the mission of those companies were to actually employ people with disabilities. In one case, it was actually a loan, and in one case, it was an equity investment. The loan was to a car wash in Florida called Rising Tide Car Wash, and everyone can look it all up. And that was actually started from scratch by a father and a brother of a young man who has autism, with the focus of being not just to employ that one individual, their family member, but to actually run a whole operation that would employ young adults with autism, male, female, and in a age range of post 21 to about 30, to Michael's point, because it was a sense of, excuse me, it was a sense of not only could we employ them, but could we also track the sense of their life? How does this improve their lives? How will they be able to do things now that we're giving them purpose and a job and money? Will we be able to also see the other results in their life? And that was not our measurement, that was their measurement as a borrower. It was fascinating. So what happens? They did borrow to open up the first car wash. They ended up hiring about 50 young adults with autism. It didn't take them very long to be that successful, one with the public and marketing and actually running a car wash, where they got to number 2, and now they're even up to number 3. So we've done 3 different loans for them over the last few years. They're up to over 90 young adults with disabilities and autism that are working there. They're getting paid living wages. Then there are the anecdotes that they're following, but they share them with us in terms of improved housing conditions for them. There's one little anecdote about how one of the young men bought his own used car and cut down his public transportation from 1.5 hours each way down to a half hour by learning how to drive and get back and forth on his own. So again, a proxy, right? They're tracking all of this stuff, and we're able to then take a look and keep hearing the numbers and the stories, and we keep reviewing with them each year. But they're basically tracking this information very, very well. The equity story was a fascinating one with a company, and talk about the situation with what we're going through with COVID and working in remote locations and everything else. Here's a company called Ultranauts that ends up hiring young adults with autism to do very meticulous work on software testing. And they were able to do it by training young adults with autism remotely. So someone could be using their own computer and being in their own home or in their own living arrangement, learning how to get this job, then actually having the job. And what had happened over the last few years is that they had grown from a startup company to now they have over 55, 60 employees, 80% of whom have autism or some form of a disability. They utilize technology in terms of Slack to maintain an HR office, so to speak. And then they approached us to do an equity investment, And again, the question would be, well, what are the metrics? What are we measuring? Well, we're measuring employment. And from the standpoint of saying, if we were to invest in your company, what are you going to get out of it? Not as a company, not revenues, not how well are you going to do, but how are you going to do on the metric that we care about, which is employment. And they said, if you do this with us over the course of the next 5 years, we anticipate that we're going to employ 200 more young adults with autism on top of the 55 or 60 they already have. That's a really amazing proxy story, because this is part of their work. And we're going to track that alongside them, but they're basically collecting that kind of data. I'll tell you one other slight, which we really didn't understand until more recently, measurement out of Ultranauts was, and we did not go into this to measure this, but now we're learning about these stories, and we're going to learn this measurement again as a proxy, as them being a proxy, because they're measuring this. But for some of the employees, they were on government assistance before they showed up working for Ultranauts. And you talk about a perfect CDFI story of going from low and extremely low incomes, because they were just sustaining themselves on Social Security, to now having a job. And they're providing us data where some of these jobs are paying $50,000, $60,000, even $70,000 a year. So again, to Michael's point, here's a situation where we don't have to go to them to grab all this data. They're tracking it real time, because this is part of their job. This is part of the reason they came to us to either borrow or invest money in them. And we enjoy the advantage of utilizing them and their measurements so that we can capture it ourselves. Why don't I stop there?
Thanks, Charlie. Toby, you've got a comment on this topic.
On the
Use of
I'm
proxy
sorry, Jack.
measures.
On the
topic
yeah,
is use
so
of proxy measures.
Correct. Thank you. I think they've covered it, quite well, actually.
Okay.
I don't feel the need to comment. I think,
Okay.
the question to always ask, or the way to think about this is, if you can't get direct information or data from the people or organizations you're trying to get it from, what's the next best source of data? So
Okay.
that's what I would
Great.
share.
Thank you. Let's ask our participants any comments or questions or concerns about the use of proxy measures. Anybody? Okay, we're going to move on. And the next topic is how to get good data. And what we're going to do is we're going to start with Michael on this. Michael, because you have a deadline here that we want to make sure you get your comments in on this topic. And then we'll turn to both Carla and Toby on how to get good data.
Okay.
Go ahead, Michael.
Thanks. Well, we had mentioned both qualitative and quantitative data, and I actually want to get back to a point that Susan made, because what she does is such a great way to get data, and what's remarkable to me is how few CDFIs actually do that, and that is to ask your borrowers if the loan has been effective, if the loan has made a difference. So the idea of an annual survey, and this gets to the two purposes of doing evaluation and measuring impact, is not simply to measure outcomes, although that is, as Charlie just mentioned, and as Susan does as well, but also to improve performance. And this is in making loans to people with disabilities. In some ways, this is an excellent way to get good data, both on impact measure and improving performance. So Susan, you may in a minute want to talk a little bit about the survey, but we often work with CDFIs to develop very simple surveys that they can give year after year. So the idea is to get good data is often data that's not one point in time, but multiple points in time. So could you do a simple survey with your borrowers where you go from year to year, and again, this is simple, doesn't cost a lot of money, and ask questions like, did this loan help you? How? Would you recommend this product or service to another person? How could we improve our service or expand our service? What would you do differently if you were us? These are the sorts of questions that CDFIs can use to really, number one, expand their market, and number two, to improve their performance, and third, to measure outcomes, to actually find out, how is your life better? Someone say, oh, I took this loan for assistive technology and I was able to get a job, which I hadn't had before. And then you can measure over time issues on very simple questions on jobs. Has the job been stable? Have you earned more income? Do you receive benefits? And you can build off fairly simple qualitative data to actually develop a quantitative database. So I want to emphasize on this, the points are can you develop a simple annual survey where you track people over time? And Susan, I'd like to hear a little bit more about what you do. And can you ask a series of questions that not just gives outcome measures for the borrower, also asks questions that would allow you to improve your performance in terms of the type of lending you do, what you might do differently. So some people might say, well, if you could make larger loans, or if you could make loans over a longer period of time, or if you could extend to this sort of technology. CDFIs often learn a lot from their borrowers if they actually ask. So let me stop there. And
Sure. So we have actually
Michael,
a couple
could I just,
Yes, Toby.
Jack, this is Toby. I just wanted to add something to what Michael was saying, and also bring up the point that was made earlier by one of the people calling in to this community of practice about collecting not default rates, but finding out what's working. I was really excited to hear about that, and because I think that's a great opportunity to capture qualitative data. So one method to do that would be a focus group or interviews with people with disabilities to find out what is behind the success of this program. If they're meeting their loan terms, or if they're particularly successful, what is it that's working for them? What is it about the program that's particularly effective that helps them do that? Or is it other things? So that's an example of a more in-depth qualitative way to capture data that's just as important as the numbers, because it helps tell a story.
Thanks. And I think, Julissa, I think there's two other slides on this, qualitative and quantitative slides. You go to the next slide, and let's make sure that we're addressing these points as we talk. So thanks, Toby. Michael, did you have more to say on either quantitative data or qualitative data before we turn it to Carla and then Toby again?
no, yeah, you can go
Okay.
ahead.
So this, Carla, did you want to address these points?
Sure. So, Julissa, if you could go back one slide. So I wanted to do a deep dive into the differences between baseline data and annual data. And so a baseline survey is you conduct that at the beginning of a project to establish the current status of your client that's being served. And for the purpose of this community of practice, then that client are people with disabilities. For CDFIs, a baseline survey is distributed to our borrowers at the time of loan origination. And it acts as a benchmark for measuring the project's success or the failure of that particular loan and that project at hand. And it can also be used to ensure that any possible impact of the project is captured for the purpose of evaluation. If a baseline study or survey is conducted after project activities have already been initiated, then what happens is an accurate picture of that initial success or status cannot really be reflected since the project already has some impact. So it's really, really important to have the baseline survey at the beginning. Also, the tools used during baseline surveys are normally the same tools that you can use during your evaluation. And this is important so that we as lenders, that we're comparing apples to apples. You know, the baseline is also looking at, and I'll get to annual in a minute, baseline, annual survey, and evaluation is all looking at the same information. And again, baseline is a benchmark for all of your future activities. Also, surveys are important in establishing the priority areas for a project. And this can be especially true when a project has several objectives. I'll give you an example. So you may have a multifamily housing project that includes people with disabilities. So the baseline survey may show that while there are units designated for people with disabilities, when you capture the data, then it could actually show that people that are in those units don't have disabilities. So then that gives you as a lender the opportunity to talk with your borrower or that developer and say, you know, you had these units that were for this population, you know, can you go ahead and, you know, influence them and, you know, put that population, people with disabilities in those units. Also, another example could be, you could have a multifamily project with supportive services. And so in asking questions such as the qualifications and the quality of the services that are being provided, this now can give you a baseline so that you can look into the future to make sure that those services were effective. And many investors require metrics reporting, and baseline surveys is carried out as part of that program. So it's important before you conduct a baseline survey to identify your indicators. And what was said before now is you don't want to make your survey very complex where people won't actually fill out the information. So you want to make it, you know, the questions that you ask or the information you're gathering, it needs to be succinct and things that people can actually answer for you. And so I would suggest that a baseline survey, you look at it in terms of 4 components. One is you want to capture organization about you want to capture data about the organization, meaning your borrower, because that's important to know of who you're lending to. And so this includes not only things like race and gender, but you also want to know if, you know, people with disabilities, and this could be their board members, management, as well as staff. And then you also want to collect data about the project itself, and then, you know, find out, does it have green components? Is it ADA compliant? Does it contain smart technology? And what other benefits does the home have in terms of people with disabilities? Demographic data. If you lend for charter schools or even for healthcare facilities, then you actually can access a lot of baseline data through, you don't have to actually ask your borrower all the questions. There's actually places you can go on the website to get this information. Like, for example, for education, if you want to get any kind of information, you can go to the state education websites. And then for healthcare, there's also a healthcare website as well. So if you all want specifics on what those websites are and the information you can get, let me know. I will say though that some of these may not have a lot of detailed information about people with disabilities. So that's disappointing but that, you know, it's like that. So for that, you may have to reach back out to your particular borrower. And then in terms of geography, you want to make sure you get geography information in terms of the area that you're serving. And you can get this information through Policy Map. So then that's another area where you don't have to necessarily reach out to your borrower, but you can get that on your own. And then you also want to get some metrics of your population. And a lot of funders, unfortunately, don't go into detail in terms of going beyond like how many people do you serve with disabilities. So, you know, you may have to come up with your own metrics in terms of what are you collecting, you know, about the population, what about their families, self-care, employment, you know, communications, you know, do they, you know, what kind of communications they need and what kind of services they need. So now once you have all this data, this is now your benchmark, and you now can use this information for annual annual surveys. And so the annual surveys, as I said before, should also mirror the baseline. So then you can compare, you know, the information year over year. And one thing that I see some CDFIs doing is aggregating this information and saying, like, you know, for all of the lending, here's what we did baseline, here's what we did annually. But to really capture if you are making an impact, it is critical to look at this information on a loan by loan basis if you can. Okay, so if you could do the next slide. So then in terms of qualitative, so we just talked about quantitative, which is counting, but qualitative is about storytelling. And so how can you now take the information of what you received in terms of the metrics, and how can you tell your story? And so it combines 3 areas. You need data insights, so the knowledge derived from your data metrics. The narrative, you need to make sure that your narratives is balancing the words, is capturing what you're trying to say, and your visualization. And so storytelling can come in a variety of ways, and it can be charts, graphs, short narratives, and videos, and that's just a few samples. So if you could go to the next one. Next, okay. So wanted to give you all an example of storytelling. And so what you have before you, this particular slide, this is from Partners for the Common Goods, our annual, we have a social impact storybook, and it's really like our annual report. And so what we do is we highlight all of the loans that that we originated within the year. And we also include, of course, like some metrics and, you know, financial information, just to get a, you know, so someone reading it can really understand who we are. And so with this particular example, what we did here is we were very deliberate in the story we were trying to tell. One, we wanted to showcase the fact of the type of lending that we do. We wanted to also highlight the fact of how 2 CDFIs can work together for for our borrower. We also wanted to make sure we put in here information about the clients and beneficiaries. And then this one, we did something in terms of we wanted to have to show the reader or tell them something that they may not know. So we introduced, in terms of this particular example, housing first. And this is a concept by which a person's, the primary responsibility is to put them into housing first and then figure out the rest later. And so, you know, I think this is a good example of storytelling. So you just want to make sure that, you know, like for this one, the words, the narrative was a bit long, but for the fact that it was in our annual report, it worked. But you want to make sure that you play around with and what works best for you. And I would even say that as you're coming up with your storytelling, that you, before you publish it, show it to somebody that knows nothing about what you do. You know, and if they can get what you're trying to say, you're a success. Or, you know, you want to make sure that you cross collaborate within your own organizations. So you might be in your marketing department, or you might be a lender, but you want to make sure that, you know, others in other fields within your organization also can have input into what the storytelling is all about. That's it.
Okay, thank you, Carla. Toby, let's have you give us any other information you want to share on how to get good data.
Well, I would just agree, you know, with Carla that, you know, there's a wide variety of qualitative and quantitative data indicators that are important to capture, both for quality improvement, performance benchmarking, and program effectiveness and impact assessment. But I think what each CDFI really needs to think about is, what is your capacity to collect the data and analyze the data? And you know, based on those capacity considerations, and I'm an evaluator and a researcher, that's what I do professionally, is, you know, when capacity is limited, less is more. So, you know, if you can capture really good, accurate data in a timely way, and it's only, you know, on 10 data elements, it's better to do it that way if your capacity is limited, rather than having, you know, a number of different indicators you're capturing, and because you're spread too thin or have limited capacity, you don't do a good job with it. So just make wise decisions in terms of, you know, what data you really need, who do you need it for, and where you're going to get your biggest bang for your buck in terms of that data.
Okay, thanks. And participants, let's hear from you. Any experience you've got with this topic on gathering qualitative and quantitative data? Any questions or concerns for our presenters? Okay, hearing nothing more on that, let's turn to how to make sure data gathering is not onerous to clients. Danny Housley, you've got comments on this.
I do. Yeah, so we use a number of ways of gathering information and data from our consumers. One, I've mentioned in previous calls the importance of just showing up to events and, you know, maybe going to a meeting or whatever the case may be. When you look at trying to get that information from folks, first and foremost, you want to make sure that you have it in an accessible format. So that could be electronic is one that we use a lot, because if we can send somebody a link, if we can hand them maybe an iPad, then they can do it, you know, right there, or they can do it in the comfort of their home or on their paratransit ride or wherever they want to. And that works well for a lot of folks. When we make something in an electronic format, we make sure that it is accessible. So if you have a learning disability or a visual disability, that a screen reader is going to be able to read everything. We use survey programs that are accessible. We test things out before we send them, because the last thing we want is for somebody to contact us and say, well, you sent me this link. However, I couldn't even begin the process of taking the survey. So that's one thing. Format is important. Now, we do work a lot across the state of Georgia, and there's a lot of Georgia that is very rural. So we also have printed copies of items as well. So we'll bring, a handful of large print formatted surveys, if that's what it is. And that way they can do that and hand it back on the spot, or we can provide an envelope for them to mail it back in, an envelope that's already addressed and stamped. Again, you're wanting to make it easy for the person to get you the information. And we'll even do over the phone surveys. So we'll call and get feedback on what a person liked, didn't like, how they're doing with the assistive technology that they've purchased. Our program does primarily focus on assistive technology loans in the state of Georgia. So, we'll follow up and say, is it still working? What else do you need? Kind of getting that sort of feedback. Now, sometimes a person may not be comfortable being super honest with a person who's working for the program. In that case, we do get a lot of referrals from our centers for independent living or independent living centers. So if that's the case, then I will work with that individual's independent living specialist and make sure that we work that survey or that data collection into their independent living plan. When people go through independent living centers in Georgia, they tend to sign up as a consumer with that organization, and then they set goals and they work towards achieving those goals with an independent living specialist or a peer supporter. So we'll make sure that, hey, well, if you're working with them on budgeting and finance as an independent living skill, let's slip the survey in there so that they can give honest feedback. That way it's helping us out, but it's also helping the Center for Independent Living out, because they're able to track data for things like the services that they're providing. So, by helping that person follow up with the survey, they're hitting a skill for independent living skills, self-advocacy, and peer support all in one go. So the center is going to get credit for that, and then we're going to get the information on the individual's experience that they had. So Centers for Independent Living are a great place, great organizations to partner with for this, because it's a mutually beneficial agreement. Now, we can also look at partnering with, in Georgia, we have the Georgia Center of the Deaf and two programs that most states have. They administer the Telecommunication Equipment Distribution Program, which does telecommunication and communication equipment for people with communication disabilities and hearing loss. They also do the Deafblind Equipment Distribution Program. So again, for our program, it's a good fit to work with them to get information on the technologies that people are using, what they're funding, and even for, if they didn't go through our program for a loan for that technology, but they went through this program, what are the reasons for that? And that helps with getting information for strengthening, again, both of our programs. We can look at getting more assistive technology funding or more funding through the telecommunication equipment distribution programs there. And again, other organizations I mentioned in the past are those peer-led organizations, working with the organizations that are engaging with that community. So things like your National Federation of the Blind, your State Association of the Deaf, your People First, which is an advocacy group for people with disabilities. It's a cross-disability organization. So looking at that to get them involved, because oftentimes there are overlaps where, again, you can have that mutually beneficial relationship. And again, it's going to strengthen your relationships with the organizations, give you more credibility with the community, and it's going to make it easier to get that information from the individuals that you're working with. So it's a multi-pronged approach to make it less onerous on the clients or the consumers, because on the best of days, nobody really wants to sit and fill out a survey, right? But if you can make it easier for them, again, something that they can do at home or on the bus or on their commute, then that makes it better for them, and that makes sure that you actually get the data that you need.
Okay. Thanks, Danny. Toby, you have something to add on this topic?
I think, yes, just in relation to everything that Danny said, the extent to which you can engage your stakeholder organizations, many of those that Danny mentioned, to advise you, give you input, before launching a survey or before hosting a focus group script, really running by the script and the questionnaire with those stakeholders so you can get input before you go through, what could be an expensive endeavor, to get data collection. Test them out first. Test the surveys out. Get feedback from people. Get feedback particularly on language and disability etiquette, so that things are worded in a way and the flow is sufficient, so that it's user-friendly, as user-friendly as possible.
Okay. Thanks. From our participants, any concerns about this topic? Does anybody have any experiences they'd like to share? Okay. Let's go on. The last topic is the use of local universities for help measuring impact. And on this topic, Toby, we're going to start with you and then turn to Susan before we go to the participants. Go ahead.
For those of you who attended the face-to-face sessions, and not all of you did necessarily, but there were some organizations that were referenced. There are many universities and universities in every state of the country called University Centers of Excellence, and obviously many states have colleges and universities that provide all kinds of resources, especially land-grant universities that are really there to serve the people in the state where you reside. So universities can be a great source of information. The UCEDs, the University Centers of Excellence, around helping with reaching the disability community in terms of crafting questionnaires. And then, there are lots of professors that actually are looking for service-related projects for students to work on. So if you're limited in your capacity or could need the additional support from students supervised by faculty to help you with your data needs, I'd strongly encourage you, to do that, either for quality improvement data, performance measurement, or impact evaluation. And it is true that some universities are looking for money, but I would say that there's just as many people out there from the standpoint who are trying to serve the community and looking for meaningful service-related projects for their students to work on. So universities are a great resource.
Good. And Susan, what's your experience?
Hi, am I off mute? Can you hear me?
We can hear you, yes.
Oh, good. Okay, well, we've also lucked into being able to get some of this research and data collection and really impact studies for free by tripping initially into University of Pennsylvania, and they have student-run organizations with faculty support called Social Impact Consulting. And I looked around, and many of the larger universities that have business schools also have those types of groups. So in the Philadelphia area, and I see there are a couple of people here who have a reach into Philadelphia, it's University of Pennsylvania Social Impact Consulting. And what they did for us is they took 2 years worth of our data of borrowers, contact information, and we reached out initially to make that introduction and said, we want to look at the impact that our loans have had on you. And did our loans make a difference was essentially it. And so it was much more confidential, and I think people were therefore eager to give their feedback. And we got a wonderful report that has helped us with other grant funding, as a matter of fact, but also helped to answer some of the questions that we had about some of our policies and procedures. Were they necessary? And what was interesting to us, the first time we did it, and we did it twice, is that we as a staff had made assumptions on some of the outcomes. So we were assuming that people who took out certain kind of loans, like for adapted vehicles, their outcome was employment. And in fact, we were mistaken that in looking at quality of life measures, people appreciated those loans highly, rated them highly, because they could go out and be with their friends and families just like everybody else. So it changed our storytelling, and it changed the way we viewed some of these loans. So I think that's one source. We also have a close relationship with our university-affiliated program, but as Toby said, they're often looking for money and hours. That's not true for all of them. But anyway, I'd be interested to know of other people's resources if they have been able to get impact studies done by some eager nonprofits or students.
Okay, thanks, Susan. Natalie, your organization is associated with a university in Oklahoma. Have you had any experience working with them on data gathering or any measuring impact?
It says, can you hear me?
Yes, go ahead, Natalie.
Since I've been with the organization, I haven't been involved in any data gathering with the university or measurement.
Oh, okay. Very good. Any other participants have experience working with universities, or questions or concerns about, sort of how to get going on this if you wanted to work with universities? All right, I'm not seeing any hands and not hearing from anybody. Let's go over the whole agenda. So we talked about outcomes versus outputs and determining appropriate outcome measures. Do people have any concerns or issues they'd like to raise about any of these measuring impact topics discussed today?
Jack, this is Susan.
Yes,
I wanted
Susan.
to make one more mention of something that Michael Slack was talking about. And can you hear me, by the way?
Yes, yes.
Oh, good. And that was in those surveys, which can be really a one-page survey, so they're really easy to disseminate. We do them online and also mail them with a stamped return envelope. But on the back, we ask one other question just to make sure people turn it over. But then we leave plenty of space for people to give us comments and be able to let us know something we didn't anticipate. And we've gotten some wonderful ideas about how people found us. And that's how we've learned, for example, word of mouth is so important. And so it circles back around to how important customer service is. And especially in this time, we've had, in the last 10 days, we've actually been getting applications through this coronavirus problem, and we've heard it's because we've been successful in remoting in that we're getting back to people, and people have appreciated it, and their needs are still as great, and they're trying to figure out if they can afford their loan, if they need to make a rescue payment. But because one survey goes out almost immediately at the end of the end of the closing of the loan, it's been really good to hear this positive feedback, because all of us are really working hard, and I'm sure many of you are all working hard, of trying to get the technology to work remotely.
Right. Okay. Anyone else on the call? Any concerns or questions or comments on this topic of measuring impact? All right. Any of the expert contributors, anything else to add?
Jack, this is Toby. I know it's been a pretty quiet call, but I'm just curious to ask, what are your data needs, or what are your data challenges to the audience? If you could share some insight into your needs and challenges related to data, that would be really helpful.
So Toby,
Peter from Fanata. Brittany, did you want to read that?
Sure, thanks, Susan. So we have a chat message from Peter, and he says he's with Fanata, and they partnered with Temple University for a research project that they completed about 1.5 years ago. A Temple professor and her grad assistant conducted interviews with over 200 of their clients to help them understand what the financial needs were for those clients in their particular neighborhood.
Mm-hmm.
They have been considering chartering a credit union, and that was the reason for the research. Now they are no longer considering chartering a CU. That was a comment.
Yeah, that's a great example. Yeah, it's a great example of when it's helpful to really engage, a university or people who have expertise in research. That's a great example.
Okay. Any other people with comments on Toby's last question about what your research or what your data needs are?
Hi, Jack. This is Lorraine. I just had a question about funding. Hi. Funding. So how do we get a research project funded? I guess that's kind of, to me, the tricky part.
Yeah, that's a really, thanks for your question. And this again goes back to your stakeholders. One of the things that I think you could do that would be most constructive as a CDFI is to truly reach out to people in your community, to organizations in your community that serve the disability community. Did you attend one of the face-to-face sessions by any chance?
Face-to-face, no, I didn't.
Right. There are, I believe, resources on the BCT webpage that may be accessible to you. But the University Center of Excellence, if you type in UCED, UCED, in your state, you should find a university that qualifies as one of those entities. And by having conversations with them, talking about your mission as CDFI and your interest in serving people with disabilities for whatever lending areas of specialization you have, I think starting those conversations, building those relationships, many of the UCEDs actually, write federal grants, state grants, foundation grants to serve people with disabilities. And their mission really is to promote inclusion in community life around employment, around housing, around all kinds of, things. So it could be a situation where you wouldn't necessarily have to write the grant. They might write a grant for you in partnership with you and then make the resources available. Okay. There are all kinds of those scenarios all the time that work out. I can't guarantee that would be their reaction, but if you build a relationship with them and talk about your interest and your mission, that's a great way to start.
Okay. All right. Thank you.
Toby, Jack,
the other thing I would add in terms of, go ahead.
I was just going to say we had another comment, but I'll let you finish first, Toby.
Yeah, what I was going to say is that there are grants and foundations that are focused on people with disabilities. So looking at, local foundations always is a way to start. But also doing grant searches that focus on people with disabilities is another, direction to go. Looking at maybe some smaller grants first to do that and help inform your program development would be a great way to go. partnering with building those collaborative partners and applying as a team and getting letters of support from disability service agencies about the need for the research or for the data gathering. That will always help. Letters of commitment or letters of support around how they're going to help you in the endeavor. That's really a successful strategy.
Lisa.
So we have a comment from Peter that instead of a credit union, we are considering a hybrid model whereby we would partner with a bank. Ideally, a bank would set up a branch and then we would be the ones holding the clients and providing the intensive technical assistance so that we can get these folks banked.
That's awesome. That's great. And was it the research project that you worked on in partnership with the university that informed that change in direction?
Yes, the research informed our change in direction.
Yeah, and note that they did interviews. So they did interviews and focus groups, if I remember correctly from the description. So that's that qualitative data. So that research partner probably did a lot of content analysis, using words and responses in that interview. Those interviews that were conducted, and there were 200. That's a large sample. So that sounds like a great report that you got back that really is helping to inform your strategy. It's a great example. Thank you for sharing.
The data showed that the cost of starting up a credit union was prohibitive.
Yep.
Okay.
Yep, that's great. And imagine if you went in the direction to build the credit union and went through all that, regulatory effort and investment of human resources, and it didn't work. So you probably saved yourself some money in the process.
Very good. Okay. Well, thank you all for your participation. Thank you for being a part of the technical assistance portion of Access for All. And this concludes our final community of practice session. So thanks, everyone. Bye-bye.
Thank you.